Growing up, I was watching my father in the fight against HIV/AIDS because he was at that time working for the Ministry of Health and going around the country for sensitizations and advocacy for funding for the medication. And seeing him so passionate about this fight against that deadly virus inspired me to go into science. I got into the master's program at the University of Pittsburgh at the Graduate School of Public Health. And from that journey there, I noticed that back home, research was picking up, but not as much. And there were few women in the field. So I decided to come back home and see how I could help. The inspiration to go into liver cancer also was sparked, unfortunately, by the passing of one of my aunts due to liver cancer caused by the hepatitis B virus. So I decided to give my best to help detect earlier the cancer so those who have it can be cured and live longer. From the studies we have done with the various teams I was part of, we noticed that the typical person affected by the cancer is males in their 40s, which are the active parts of the society that have families. That's what inspired us to tackle that problem. For such a topic, you need a multidisciplinary team. So I had to connect with clinicians because they're the ones seeing the patients, so they can understand the work we are doing in the lab and how they can contribute and how the result also will help them in their daily practice. The problem that we're trying to solve here is to pick up early on the cancer before it spreads. And the way we are looking at it is to develop a rapid test or a blood test that would be able to tell when the cancer is starting, and so that those patients can get surgery and have the part removed so they can live longer. And so far, we are able to identify some proteins that are coming up differently between people who have chronic infection of hepatitis B virus, cirrhosis, and liver cancer against healthy people. So the next step would be to validate those proteins. The way that my research paves the way for future research is that once the proteins that we isolated using the proteomics technique are validated, this process could be also used for other types of cancer that are difficult to pick up early. As an example, I can give the example of pancreatic cancer that are also diagnosed very late in our context. As a woman, my ways to contribute to research is to nurture the passion for research in young women by giving them the example of what I'm doing and getting them up to speed so they don't get discouraged by the hurdle of life, showing them that it's possible to achieve. So my hope, I say it kind of aligns with WHO goals, is to have the maximum of people affected by the hepatitis B virus know their status, and also be able to detect really the liver cancer earlier. Will save a lot of lives in Africa and the world at large.